Hello, and it's a welcome number 3 to the last section, to the last lecture of infectious disease epidemiology session number 3. The chapter outline is that in this topic, in this session, we are going to talk about epidemiological triad, chain of transmission, what are the modes of transmission, very important, highly asked in your exam. What is the modes of transmission? Next is the time periods of infection. We are going to talk about incubation period, generation times, and so on. Isolation, quarantine, control, elimination, eradication, investigation of epidemic, and infection control, PPE, donning and doffing procedures. So let's get on and talk about the first topic. What is the epidemiological triad? See, what is epidemiological triad? First MCQ. There is agent, there is a host, and there is an environment. So there should be a susceptible host, there should be aggressive agent, and there should be a compatible environment for all the diseases to happen. So this funda of agent, host, environment is called as the epidemiological triad. Okay, next question number 2. I'm going to confuse you now. What do you mean by the epidemiological triangle? Beta, the epidemiological triangle, it states that there should be agent, there should be host, environment, and there should be with time in between. There should be time in between. The agent should be there with the host at the optimum environment for a particular time. Only then there will be disease. So when will you have disease? The interaction between epidemiological triad means the interaction. It means the interaction between agent, host, environment, and time. Very important. So what is triangle? Triangle is nothing but epidemiological triad with the time factor. So I know it's going to confuse you, but that's how community health nursing is. So you need to understand what is epidemiological triad and what is epidemiological triangle. Now to confuse you even more, we have something called as what is advanced model of epidemiological triangle. So what is this advanced model? Advanced model of the epidemiological triangle. So you already know that the agent is there, the host is there, and the environment is there. We already did this couple of times. So you replace the agent with the causative factors, all causative factors. It could happen for myocardial infarction. You can talk about coronary artery disease. You can talk about diabetes mellitus. So all causative factors or the epidemiological, etiological factors. Then as host factors, you replace it with the population factors, all the population factors, and the environmental factors, you replace it with the socio-cultural factors. You replace it with political factors. In one word I have remembered, you replace it with ecological factors. Ecological would include almost everything. So causative factors with the population factors, with the socio-cultural or the political or the ecological factors, this is called as the advanced model. It is the most accepted theory of why disease happens in people. So that is what is about the epidemiological triad. Everything, every definition that I'm speaking over here will be used sometime later in different parts of the lectures. So make sure that you understand them very nicely, and these are frequently asked questions in your exam as well. Topic number 2, what do you mean by the chain of transmission? See beta, that there is an infectious agent. The agent is going to maybe the reservoir. It will, you remember what is reservoir? Reservoir is any natural habitat. The reservoir may start spreading to people or to other animals or to humans. It may become a source, and the source will infect the host. Am I correct? Humans, and the humans will again shed off the agent, and that's what is the life cycle. Okay. If I just make this whole thing more complex, the agent is going to the reservoir. The agent will enter the reservoir. You see over here, the agent will enter the reservoir, and the reservoir will go to the host. The reservoir has to go to the host, but there is a portal of exit from the reservoir, and then in the host there is a portal of entry. From the portal of exit from the reservoir to the portal of entry in the host, there is a mode of transmission. Very important for you to understand. There is a mode of transmission. There is a way that the infectious agent was traveling from the source to the host. I talked to you agent, host, environment. So from the agent to the host, how does it happen? So we are going into this point now. So from the agent, it has to go to the host. How will it go to the host? Agent goes to the host via the reservoir, via the source. There is a portal of exit, and then there is a mode of transmission. Then there is a portal of entry to the host, and then there is again a portal of exit for the agent to happen. So this phenomena is called as chain of transmission. MCQ over here is that in this chain of transmission, which is the weakest link, which is the most delicate point. The most delicate point is the mode of transmission. If you want to stop the chain of transmission, if you stop the infection, how will you stop the disease from happening? You saw in my previous in the previous topic number 1, where we discussed topic number 1, that is the epidemiological triad. You understood that how does disease happen? You know, there is agent, there is host and environment, and you already talked that the interaction between them, these are the people who will get the disease. The agent, the host, and the environment, when they interact. So how will you stop the interaction? To stop the interaction, you should cut the chain of transmission. You have to interrupt the chain of transmission. Which is the weakest link? MCQ, which is the weakest link in the chain of transmission? The weakest link in the chain of transmission is the modes of transmission. You stop the mode of transmission, and that is the only point where you can cut the chain of transmission. In fact, you cannot finish off the agent. You don't want to finish off all the microbes in the world. You do not want to kill all the reservoir or the source in the world. You do not want to kill all the host also. So what are you going to do? You want to prevent disease in humans. So because we all are humans, right? So you want to prevent the disease in us all. So how will you prevent that? You have to cut the mode of transmission, cut the chain of transmission. So that's the understanding about the chain of transmission. Only one MCQ, which is the weakest link. Please note that the weakest link is the mode of transmission. You have to interrupt the transmission at the mode of transmission. Now comes the point number 3. What do you mean by the modes of transmission? MCQ, very frequently asked topic in your exam. Beta, there are 2 modes of transmission. The mode of transmission could broadly be classified into a direct mode of transmission, or there could be indirect mode of transmission. The infection may spread directly or it may spread indirectly. What are the direct mode of transmission? It is D-ticks. Direct mode of transmission is D-ticks. Indirect mode of transmission is favorite ultraviolet. So what do you mean by all this? D-tick stands for direct. D-tick stands for droplet mode of transmission, transplacental mode of transmission. I stands for inoculation. C stands for direct contact or touch, and S stands for soil. Please note, very frequently the examiners have asked about soil. Soil is a direct or indirect mode of transmission. Soil is a direct mode of transmission. Next is coming to the other hand. What are the favorite ultraviolet? F stands for fomites. A stands for airborne. V stands for vector-borne. U stands for unclean hands. Very frequently they have asked again, unclean hands are direct mode of transmission or indirect mode of transmission. Unclean hands are indirect mode of transmission. Soil is a direct mode of transmission. No confusion. Okay. And last point is the V again. It is a vehicle-borne transmission. So we'll discuss everything now. So let us talk about the droplet later on, but first let us talk about transplacental mode of transmission. Beta, in the transplacental mode of transmission, what are the infection which there are some infections which can spread through the placenta, right? So in the first trimester, there are some infections which can spread. Very important, you need to talk about rubella infections. If the rubella infection happens early in the pregnancy, it is very bad for the child because of the presence of, because this rubella infection in the mother, in the mummy, she can cause a congenital rubella syndrome. Congenital rubella syndrome in the child. So rubella infections or varicella infections or the chicken pox early in the pregnancy is not considered to be very, very good. Then in the mid trimester, we can have the CMV infections, which are very bad. And in the last trimester, that is the third trimester, that is the last trimester, we can have syphilis, which is not at all very good infection during pregnancy. So syphilis, particularly in the later part, it's a very hazardous. Anytime during delivery, some of the infections can be asked in your exam during the course of delivery, during the labor pains, during the delivery course. There could be chance of infection spread like tetanus. There could be chances of hepatitis B to spread. There could be chances of HIV to spread. So these all infections, these specifically the three infections, they can be transplacental, that is vertical. These are also called as the vertical spread. Vertical spread, that means from the mother to the child. So transplacental infection means from the mother to the child in the first trimester, mid trimester, and in the last trimester. Some infections very commonly may spread. Next is, what do you mean by inoculation? Inoculation means direct on the skin, through the skin, in the tissues. So inoculation, technically it means inoculation. So some infection directly goes inside the body. How will you inoculate? Example is needle stick injury. Needle stick injuries. So these are classified as inoculation injuries, needle stick injuries, which may transmit, I think many of you already know, hepatitis B, it could be hepatitis C, it could be HIV, it could be any other infection as well. So inoculation could also be, one example is needle stick injury. Inoculation could also be direct animal bites. Animal bites. Direct animal bites, for example, rabies. For example, any wild animal bite which may spread any gangrenous infection or rabies infection. These all are inoculation injuries, and these are inoculation mode of transmission. What is direct touch or contact? So that is direct by touch. Example would be all contagious diseases. Very typical example of this is scabies. No MCQ as such on this. Soil transmission. Soil can be interesting. Soil can transmit many infections through the soil. So soil transmitted infection could be many fungal infection, mycosis. These are better the fungal infections. The soil transmitted could also be the soil transmitted helminthic infection. Soil transmitted helminthic infections. The soil could also be transmission for tetanus. So soil could be one of the source and the reservoir for tetanus. Please remember this. Next in line, let us come to the indirect. I will talk about the droplets later in time. Next is about the indirect mode of transmission. What are fomites? Fomites, what do you mean by fomites? Fomites are usually, not usually, they are inanimate. They are inanimate. Inanimate, what does it mean? It means the non-living. Inanimate or the like pen. Pen is a fomite. The table is a fomite. The tablecloth, anything that we hold, the banknotes, the coins, the currency that we hold. So fomites are currency. Fomites are pen, paper. The stethoscope that we use in the hospitals, they all are fomites. Fomites are any inanimate or non-living things on which the infection may be present. So actually the fomites are contaminated, and fomites are very important indirect mode of transmission. Next is vector-borne. I'll talk about airborne later in time. So airborne and droplet I will discuss later on. What is vector-borne? Vector-borne means that through the vector. So vector-borne means through some vector. What is the vector? Please note, any arthropod or any non-vertebrate animal or any insect, that is vector-borne. Usually example could be mosquito-borne, example could be sandfly. They can work as vectors. Example could be anything which is housefly. So these all different vectors. It is any arthropod borne. So mosquito may spread malaria, may spread dengue infection. Sandfly may spread Kala Azar, right? Sandfly may spread Kala Azar. Housefly will spread a lot of infections via mechanical transmission. Please note mechanical transmission. Do you know how does the housefly, the makhi, that is the common household fly, which is there on food, which is there on feces, how does it spread infection? It doesn't eat the infection, it doesn't eat the feces. So housefly sits on feces, and through the foot of the housefly, the foot will transmit some infectious particles of feces from the fecal matter or from the soil to the food. So there is a mechanical mode of transmission, and that is the reason we call the vectors as an indirect mode of transmission, right? Talking a little bit more about the vector transmission, this can be frequently asked MCQ, a little bit more about vector mode of transmission. The vector mode of transmission could further be classified into the biological transmission could further be classified into propagative, cyclodevelopmental, or a cyclopropagative. So what's all this? See, let us say that there is a vector. For example, there is a vector, okay, any mosquito or anything. So in the vector, there is one microorganism which enters into the vector, and let us say there are many microorganisms which come out. So what is happening over here? What is the change which is happening? What is the change which is happening? Is there a change in size or shape or stage, or is there only change in number? You say, what is happening? There is beta a change in number. Please note, if there is change in only number, one thing enters and 20 come out, this phenomena is called as a propagation. It is a propagative mode of transmission. So, okay. So where are we right now? What are we discussing, beta? We are discussing the modes of transmission. Direct, indirect mode of transmission. Indirect mode of transmission could be favorite, ultraviolet. So you can have fomites, airborne, vector, unclean hands, and vehicle. We are discussing the vector-borne. The vector-borne transmission you talked about, there could be a mechanical transmission. There could also be a biological transmission. So we are right now discussing about the biological transmission within the vector-borne transmission. The biological transmission could be divided into propagative transmission, cyclodevelopmental, and a cyclopropagative. So that's what I'm trying to explain. What is a propagative transmission? Propagative transmission is when there is one infectious agent entering into the vector and there is change in number. Next is, there could also be a certain scenario where there is, let us say there is a vector. In the vector, there is, let us say, one microorganism comes in. Now one microorganism comes in and there is only one thing coming out, but that one thing is different shape or size. Let us say there is a change in what? Change in the stage. There is a change in stage, or there is development. This type of transmission, it is called as a cyclodevelopmental transmission. It is called as a cyclodevelopmental transmission. Okay. Let us say that there is a third scenario. There is a vector over here. Okay, now let us say there is one microorganism enters, and now many microorganisms, they come out. They all are of different shapes and sizes, and there is a change in number also. So what is happening? There is change in both. There is change in number, plus there is change in stage also, or there is change in the developmental state also of the microorganism. So what is happening? There is a cyclical change. There is a cyclical change with the propagation. So this phenomena is called as a cyclopropagative transmission. Okay, so there could be three types of transmission through the vectors. There could be a propagative, cyclodevelopmental, or a cyclopropagative. Okay. Examples for this: propagative, P for propagative, P for plague. P for propagative, P for plague. Next is cyclodevelopmental. One thing comes in, one thing comes out, but in a different shape. Example you can remember, cyclodevelopmental is, example is microfilaria. Microfilaria. What is microfilaria? Did you remember when we talked about vector-borne disease? This is microfilariasis, that is in the culex. So a propagative is for plague. Cyclodevelopmental is microfilaria, that is lymphatic filariasis. Lymphatic filariasis in culex mosquito. Okay. Next is, what is cyclopropagative? Cyclopropagative is there is change in shape and there is change in number. Example, typical example for this could be malaria parasite. Malaria parasite, where in which vector? In the Anopheles vector. Anopheles vector. Microfilaria in which vector? In culex mosquito. You remember? Microfilaria in culex will cause lymphatic filariasis. Plague. Plague in which vector? What are the vector we are talking? We are talking of rat flea. Rat flea. So plague, rat flea, developmental is microfilaria and culex. Cyclopropagative is malarial parasite in the Anopheles mosquito. So these are the examples of different biological modes of transmission. Okay, so you have talked about the propagative, cyclopropagative, and the cyclodevelopmental mode of transmission under the vector-borne mode of transmission. Next is unclean hands. Unclean hands can happen with any infection. Last is what is vehicle-borne. What do you mean by the vehicle-borne mode of transmission? What is this vehicle-borne? So what do you think is vehicle-borne? When will you say a disease to be vehicle-borne? Vehicle-borne does not mean the car or the truck or the bicycle or a road type of diseases. So those are classified under the road traffic accident. Vehicle-borne means vehicle. That means the infectious agent needs a vehicle. That means it will need some water or blood or feces to pass through. So it could be waterborne, it could be foodborne, feces or foodborne, it could be bloodborne, it could be waterborne. So these are the vehicle-borne. Waterborne example could be anything like cholera, it could be diarrhea. Bloodborne could be all hepatitis, it could be bloodborne infections. A lot of bloodborne infections could be there. Foodborne, a lot of foodborne infection. Typically you can have typhoid. We can also have hepatitis. Hepatitis again, which could be a fecal-oral mode of transmission. You remember hepatitis A or hepatitis E, which is a fecal-oral mode of transmission. So these all would be categorized as vehicle-borne. Okay. And now let us talk about what are the droplet-borne and what is the airborne mode of transmission. Let us say that there is a person, and let us say this person sneezes or cough. If I cough or if I sneeze, there will be droplets which will come out through the mouth. Right, so there will be so many droplets. So there will be droplets, lot of droplets. Common sense, some droplets will be bigger droplets, some droplets will be small droplets. Okay, so the droplets which are bigger, these are called as the droplets. They are bigger in size. They will usually travel 30 to 60 centimeters in length. They can travel 30 to 60 centimeters. Okay. There will be some smaller droplets which will fly in the air. Don't you think there will be some smaller droplets which can fly in the air, and they can travel lot of distances depending on the air velocity, depending on the humidity and different factors. So now these smaller droplets, these are called as droplet nuclei. Very important. These are called as the droplet nuclei. MCQ, what are droplet nuclei? Droplet nuclei are the dried residues of droplets. These are the dried residues of droplets. So some infections can be carried via the droplets, and because droplet will spread only to a shorter distance, that is the reason we classify the droplet into a direct mode of transmission. Whereas the droplet nuclei, they will carry the infection. They may carry the infection over longer distances. They may carry a distance over few hundreds of meters. They can also spread to few hundreds of meters, and that is the reason they are put under the indirect mode of transmission, and the droplet nuclei mode of transmission is what is called as the airborne mode of transmission. So now you have understood that the person can sneeze and can either throw droplets or they can throw droplet nuclei. Droplet nuclei, these are the droplets which will, small droplets which will fly over long distances, and they are called the droplet nuclei, which are the dried residues of the droplets, and that is what is classified as the airborne mode of transmission, and these are indirect mode of transmission. MCQ for your exam, what diseases will have the direct mode of transmission? Direct mode of transmission will happen in almost all the respiratory infections. It could be almost all the respiratory infections, they have a droplet mode of transmission. Talking about the airborne mode of transmission, airborne mode of transmission can happen for very particular specific group of diseases. For example, tuberculosis, measles, chickenpox, influenza. Tuberculosis, measles, chickenpox, influenza, COVID-19 and SARS infections. So these are the ones which have an airborne mode of transmission. They can spread over hundreds of meters, and they are classified under indirect mode of transmission. And because they are airborne, you need special precautions over here. You need special precautions as a nursing officer or as a nurse who's treating these patients, or as a physician, as a doctor also, people, health professionals, they will need special precautions while treating the cases of measles, chickenpox, influenza, COVID-19 or tuberculosis. Why? Because there is an airborne mode of transmission, right? So next level, let us talk about the next point. What are these modes of spread of infections? So we can have different time periods. There could be incubation period, which we had a discussion in the previous module, generation time or serial interval. What is incubation period? We already had a discussion. Incubation period is the time between, it is the time between the entry of microorganism microorganism and the first sign and symptom. That is what is the incubation period. What do you mean by the generation time? Generation time is the time between, very important MCQ, generation time is the time between the entry of microorganism and the maximum communicability. That is what is called as the generation time. So technically speaking, MCQ, generation time is also known as the extrinsic incubation period. It is the time difference between the entry of the microorganism and the maximum communicability, whereas the incubation period is the time difference between the entry of microorganism and the first sign and symptom. Incubation period, and we have the generation time. What do you mean by the serial interval? Serial interval is nothing. It is the time difference between, the primary case and the secondary case. Do you remember we talked about the primary and the secondary cases in the previous module? What is the primary case? Primary case is the first case in the community. What is the secondary case? Secondary cases, these are the subsequent cases that you have in the community which arise from the primary case within one incubation period. So the time difference between the primary case and the secondary case, that roughly, don't you think, will correspond? It roughly corresponds, it approximates to the median or the average incubation period. It will tell you about the incubation period. So incubation period, generation time, and serial interval, these are directly asked MCQs. For your MCQ exams, you sometimes have been asked about various incubation periods. Grossly, you should know that diseases like diarrhea, and respiratory diseases like influenza or flu, they have very short incubation period. Most of the measles, mumps, rubella type of diseases, they will have roughly from 1 to 2 weeks of incubation period. Disease like chickenpox, it has 1 to 3 weeks of incubation period. Mumps specifically has 2 to 3 weeks of incubation period. Rubella has 2 to 3 weeks of incubation period. Okay, so hepatitis A has approximately 1.5 to 2 months of incubation period. Scabies is again 1 to 2 months of incubation period. So you can remember about the incubation periods grossly, like within 3 days, 1 week to 10 days, or 1 week to 2 weeks, and 1 week to 3 weeks, or 2 to 3 weeks, and more than 4 weeks. So you can just categorize the disease accordingly. So you can see these are usually around 1 month. You can remember the incubation period as 1 month. So for diseases like usually the respiratory infection, they'll be around 1 to 2 weeks or 1 to 3 weeks. So you can remember some of the incubation period. If you have understood this, now let us go to what do you mean by isolation and what is quarantine. Beta, please note, you always have talked about isolation, right? COVID-19 isolation and COVID-19 quarantine. So what's the difference? When do you say quarantine and when do you say isolation, beta? Isolation is a specific term which is used for people who have the disease. So people who have the disease, isolation is done for the disease people or the disease population. It is done for the cases. Isolation is done for the cases. Why do you do isolation? To prevent others from getting the disease, right? So you will isolate for how much time? Will you isolate for the incubation period? Answer is no. Common sense, the person already has a disease. Why would you isolate? Like the patient already has a disease, so there is already the sign and symptoms. It's not about the incubation period. It is for what? The isolation is to be done for the maximum period of communicability. It is to be done for maximum period of communicability. Okay, so period of communicability is very important for defining the isolation periods. And primarily, when will you do isolation, or for what you will do isolation? It is for all communicable diseases, specifically talking about measles. You have to do isolation. Why? Because there is airborne mode of transmission. Measles, usually it is for 7 days after the onset of rash. So from the day of the onset of rash, for 7 days. For COVID-19, usually the isolation is for 14 days after the onset of the fever, first day. And similarly for tuberculosis, it is usually for 3 weeks after the patient starts the treatment, or for at least after the patient has the first stage of cough or any features of tuberculosis, for at least 3 weeks they should be isolated. So that technically ranges around the period of communicability. Now, what on earth is quarantine? How would you differentiate with isolation? See, quarantine is for people who may be infected. If I was in contact with anybody who probably was having COVID-19, when will I show the sign and symptoms? After the incubation period? So during that incubation period, I could be spreading the disease. So therefore, you need to quarantine me. Why? Because probably I am infected. For how much time? For the incubation period. So these are the MCQs you get on quarantine, if you have understood it again. If not, just pause the video, rewind the video and listen to me again. What is quarantine? So please note that quarantine you do for whom? Quarantine you do for apparently. Apparently is a key word over here. It is for apparently who think they are healthy. Apparently healthy population. Healthy population. Why? Because they may be carrying the infection. So quarantine is done for preventing spread of infection after the sign and symptom or before. Common sense, it is spread of infection before signs and symptoms. So quarantine is done for how much time? Quarantine is to be done usually 2 times of the incubation period. Median incubation period, you just double it up and you say that the quarantine has to be done for this much time, because you're playing safe. You don't want people to get infected. Of course, quarantine is also done for all the communicable diseases. So roughly you would say that quarantine plans are there for the most double the time of the incubation period. So that's about the quarantine and about the isolation. So this is just a summary table that I have prepared for you. You can remember almost everything, but of course the ones which I'm going to highlight. Chickenpox, very important. You should note that chickenpox, the person is usually isolated till 6 days after onset of rash. Similarly for measles, it's again for 6 to 7 days, not 6 days, 7 days after the onset of rash. So these two have been asked in your exams. Very frequently they will ask you about COVID-19 also, that the duration of isolation is roughly around 2 weeks after the onset of the fever. For tuberculosis, I already told you it is after the 3 weeks after onset of the chemotherapy. For zoster infections, again it has been previously asked MCQ, it is done for 6 days after the onset of the zoster rash. So a lot of times they'll ask you questions about the duration of isolation, so you should be remembering what are the duration of isolation in these cases. So if you look at the lecture outline, we have already discussed about the epidemiological triad, chain of transmission, modes of transmission, time periods, isolation, quarantine. Let's talk about what is control, elimination, and eradication. So what do you mean by control, elimination, eradication? Beta, you already know there is agent, there is host, there is environment, and the interaction between them will cause the disease. Your main purpose as a public health nurse, or you could be working at a district level, you would be a district public health nurse, right? DPH. So you could work at a district level or at a PHC level or even at a state, or you could be even managing the whole country. So let us say that your main focus is to prevent disease. So how will you prevent the disease? You need to pull back the agent, you pull back the host, you pull back the environment. That's what you're going to do. Right? So how will you pull back? You remember the chain of transmission. To cut the chain of transmission, you have to stop the mode of transmission. So that's what you do in control, elimination, and eradication. So in the process, when you are cutting the mode of transmission or when you are interrupting the chain of transmission, during that interruption, if this is the agent, the host, environment, and when you are pulling them back, there could be a possibility that now this very few number of cases will have disease. Very few number of people will have disease. So this very few number of people will have disease is called as the first stage of prevention of disease. That is what is a control phase. So MCQ, what do you mean by control? Control means when the disease is no more a public health problem, is no more a public health problem. So when the disease is no more a public health problem, that phase is called as a control phase. Point number 2. Let us say there is agent, host, environment, and in the process of pulling back the agent, you pull back the host, you pull back the environment, the agent, the host, the environment, now there is no more interaction. You've already cut the chain of transmission. So now if you have cut the chain of transmission, you have interrupted the chain of transmission. Will there be new cases? Mark the language that I'm saying. Will there be new cases? Answer is there will be no new cases. Now, because if there are no new cases, what is this stage called? Is it called as control? No, this is not called as control, because the control is when the disease is no more a public health problem. The disease is there, but it's not in a very big level. So this phase, there is no new cases. This phase is called as elimination phase. What do you mean by elimination phase? Please write down for your MCQ exams. Elimination phase means there are no new cases. Why are there no new cases? Because there is interruption of mode of transmission. Why do you want to interrupt the mode of transmission? Why? Because somebody told you that you have to cut the chain of transmission to stop the disease. So that is the reason there are no new cases. Very important. But the infectious agent is still there. The agent is there, the host is there, the environment, they all are still there. So after many years of elimination, there could be some diseases which are in elimination phase. After many years of elimination phase, now don't you think that the agent would be there, the host will be there, and environment is there. Now the agent means any microorganism, right? So this agent, it needs a host to replicate. You remember infectivity, you remember reservoir, you remember source. The agent, it has to sustain in nature, and to sustain in nature, it has to replicate. To replicate, it needs a host. Now you are not letting the agent meet the host. So don't you think that after some years, the agent is going to die off from the universe, to die off from the planet, or to die off from the area, to die off from the geographical area, or could be bigger area or smaller area, whatever it is. So now there is only what is present. There is only the host and the environment which remain. There is no more agent, that particular agent. This phase is usually a permanent phase. Elimination is a temporary phase, whereas this phase is a permanent phase. This phase is called as eradication phase. MCQ, what do you mean by eradication phase? Please write down. What do you mean by eradication phase? Eradication phase, it is the last phase. It is usually a permanent phase. Eradication means complete extermination of the infectious agent. So complete extermination of the infectious agent. Will there be new cases? Obviously there are no new cases. Common sense. And there is complete extermination of the infectious agent. It is usually permanent phase. This is what is eradication. So what is elimination? It is also no new cases, but the hallmark MCQ will be it is interruption of the mode of transmission. What is eradication? It is extermination of the infectious agent. That is the reason there is no new cases. MCQ next, what are the diseases which has been globally eradicated? So MCQs now. Which diseases have achieved a global eradication? Please note, global eradication has been achieved for only one disease, that is smallpox. In India, we are proud to say that we have eradicated smallpox. Right? Smallpox, the last case happened in 1977 and it was subsequently declared as last case was in 1977 and it was declared as eradicated in year 1980. In May 1980, it was declared as eradicated. In India, smallpox has been eradicated. Along with smallpox, we are proud to say guinea worm disease is eradicated. Guinea worm disease. This is also called as, also known as dracunculosis, right? Dracunculosis. So dracunculosis is also eradicated, guinea worm disease, smallpox. Also, we are proud to say that wild poliomyelitis has achieved a regional eradication in India. Then we are also proud to say yaws is not there, and these are the diseases which have had a country level India eradication. I would also like to tell you that some diseases have achieved a special elimination status. Special elimination status has been achieved for neonatal tetanus, and also for another disease, I think you know it, that is childhood trachoma. So the country has ensured that the neonatal tetanus, I'm not talking of the tetanus, the neonatal tetanus in neonates does not happen in India. Trachoma in children does not happen in India. So they have achieved special elimination status. It's not about eradication, because the tetanus, bacilli is still there, Clostridium tetani is still there, childhood trachoma is still there. Trachoma is still there, right? But in the children, there is elimination status. And diseases which have been eradicated in India, that's a smallpox, guinea worm disease, wild poliomyelitis, and yaws. These have been eradicated in the country, right? So you should know what is control, what is elimination, and eradication. Eradication is usually a permanent phase. Elimination is a temporary phase. There is interruption of transmission. And control phase is that the disease happens in the area, but it is not a public health problem. It is not a public health problem. That is what is the control phase. Coming to the last few of the last topics, how do you investigate an epidemic? Let us say that the epidemic is taking place in any area. You are the public health nurse over there, and you have been assigned the task that please go and investigate the epidemic. Let us say there are a lot of jaundice which comes to your notice. You are working in a primary health center, and suddenly you get a call from the ASHA worker, from the ANM in the area, from the MPWs in the area that dear, I have a lot of jaundice cases. That maybe sir or madam, it could be because of hepatitis A outbreak. It could also be because of some unknown disease. So what is happening? We need to investigate. So you as a public health nurse, you would go over there and you need to try to find out what is the reason. So that concept is called as investigation. There are a few steps which are there. So first step is always, it has been asked, such frequently asked MCQ, what is the first step in the investigation? The first step is always you need to find out the diagnosis first, whether it is hepatitis A or it is hepatitis E or it is some other liver disease which is happening in the area, or it is some diarrheal disease. What is happening, you need to see. Second is you need to confirm the epidemic. What is epidemic? You remember, epidemic is when it is more than +2 standard deviation of the normal frequency, or when the disease is more than 80% of the expected frequency. That is called as epidemic. Third is you need to define the population at risk, that how many people are there in the area who are at risk of that particular disease. Last is do rapid search of cases. These are the most important. And then is all the, like, of course, every step is important, but these first four are which are done in the field there, and then they have to be done within a stipulated time. Then you are allowed to do data analysis, formulate, test hypotheses, evaluate ecological factors, further investigation, and very important, in fact, the most important, I would say, most important step would be report writing, and to tell to the public, to tell to the officials, to your seniors also, that this is what actually happened. You can't do an investigation and keep everything to yourself. So this also has been MCQ, that which of the following is the most important? It is dissemination of the data. Anything that you discover, anything that you invent, anything that you do in the public health structure, it has to be given to the community at large. You have to inform your seniors. So it should always be propagated further. So report writing is very important. Most first step that you have to do is verification of diagnosis. Next is you have to identify whether it is above the level or below the level. How will you identify whether it is epidemic, yes or no? You define how many people are at risk, and you do search for the cases. So this is the steps of the investigation of epidemic. Next in line is what are the infection prevention precautions that we can take. Let us say you are a nurse in a hospital, and in the emergency duties, you get a patient who's coming with measles or with chickenpox or with COVID-19, things like these. So diseases like tuberculosis, measles, COVID, influenza, chickenpox, we already told that need airborne precautions. Diseases simple like rash, fever or cough, they need a droplet and or airborne mode of precautions, but at least you need droplet. So this has been MCQs that most of the respiratory infections, they need minimum what level of precautions. You should have droplet precautions. What are these precautions? I'm going to tell you, but at least note that there should be droplet precautions. And diseases like tuberculosis, COVID-19, they need airborne mode of airborne precautions. And most of the other diseases like abscess, diarrhea, vomiting, they just need contact. So contact precautions actually means presence of gloves and appropriate shield over there, so that no infection or no secretions are able to enter into your body. So you should have a shield, like the gloves should be there to stop the infection entering into your skin. That's what is a general precautions. Droplet precautions would include the gloves with mask. Airborne precautions would include with a high quality N95 mask. Airborne precautions would include N95 mask with gloves, and if possible there should be a personal protective complete equipment. So what is this PPE? PPE would include face head cover, it includes eye cover or face cover, that is the face shield, then it includes the mouth cover or the mask, then it includes the hazmat suit, which is a full body cover, then it includes gloves, and last is the shoe cover. So these are the elements. How many elements you can see? I can see 6 elements probably over here. Yes, 6. So 1, 2, 3, 4, 5 and 6. So these are the 6 basic elements which you need in airborne precaution. It is always recommended that in diseases like COVID-19, influenza, chickenpox, handling very close proximity. So if you're doing some intubation procedures, if you're doing some very close secretion producing interventions in the patient, so in those cases you need to have complete 6 personal protective equipment. Next is, sometimes the examiners may also ask you that how do you wear the PP or how do you take off the PP? Taking on the PP, wearing the PP, taking on the PPE is called as donning procedure. It is called as donning procedure, whereas taking off the PP, this is called as doffing procedure. So taking off or taking on, this is what is donning or doffing. Please note that whatever guidelines I will be talking to you about the donning or the doffing procedures, it is all WHO or the standard CDC guidelines. For COVID-19 guidelines, there are special AIMS have given a new guideline, that is a separate guideline that is to be followed for donning and doffing procedures, but that is specifically given by AIMS. So I'll be just giving you a hint about that guideline because that guideline is not applicable across the country, across the places. Okay, but WHO CDC guidelines is followed across the whole world. So what are the donning and doffing criteria? Please note that this topic will also be covered by our star faculty Sabina madam in the Foundations of Nursing or in other parts of the Mastermind pack also. But over here in this session, I'm focusing more on WHO or the CDC guidelines. So as per the WHO CDC guideline, first thing that has to be worn is the apron. So whenever you enter the OT also, the first thing that you do is to wear an apron, right? That is to wear the OT gown. So that is the first thing that you do, is you wear the apron. The second thing that we need to do is wear the face mask. Third thing is the face shield or the eye cover. Eye goggles, the face shield or the eye goggles. Please note in the face shield also, this is an important MCQ, that what thread would you be tying first? It is the bottom thread first, bottom thread first. So it is the bottom thread which has to be tied first, and then you take on the above thread. And last is you wear the gloves. So that is what is the standard WHO. So now AIMS people, they gave their new COVID-19 guidelines. Nothing very special. Just understand that in COVID-19 guidelines, they told, the AIMS people told that you have to wear 2 pairs of gloves. So one is inner pair, then there is outer pair. So first what you do is you wear inner pair of gloves, then you wear the gown, then you sanitize, again wear the mask, again sanitize, again wear a face shield, then you sanitize again, in the last wear the outer pair of gloves. Very simple. So the only change that in the whole sequence is adding an extra pair of gloves. Otherwise this apron, mask, goggles and gloves, this is what we is followed as taking on of the PPE. So first thing is the biggest thing, that is the apron. Second is the face mask. Third is the eye goggles or the face shield, and fourth is the gloves. That's all, simple. So how do you take off? Taking off is, first procedure is take off the gloves. Very important. Then you open the bottom. Then you first is you take off the gloves. Then you take off the face shield or the goggles or the eye goggles, right? So when you are taking off the eye goggles, which thread to be removed first, the upper one or the lower one? Please note it is the lower first. It is the bottom first. It is the bottom first. So while wearing, you wear the bottom first. While taking off, you take off the bottom first. Always the bottom first. It's very important for you to remember, while taking on, bottom first. While taking off, bottom first. Always the bottom is first. So the lower thread is to be taken off first. Second, third in line, you take off your apron or the gown. Last, very important, this has been asked so many times in your MCQ. The last step always has to be take off the mask. The last step has to be take off the mask. Mask should be taken off, at least in airborne mode of precautions. The mask should be taken off. It should be taken off after exiting the isolation area. Very, very, very important. So beta, after you exit the isolation area, have you ever been to a ward, to isolation ward? Have you ever been to a COVID-19 or measles or chickenpox isolation room? So there will be usually 2 doors. So first door is for inside. The room is there, then there is a door, then there is a changing area, and then there is outside door. So the outside door will lead into that corridor in the hospital. Okay. So within the first door and the second door, usually we take off the mask, or you take off the mask after exiting, usually within the first and the second door. So please note that after you exit the isolation area, then you take off the mask. Do not, never take off the mask within the patient's room. That is what is most important in the airborne mode of precautions. Okay. In case the MCQ wala, they ask you about the AIMS, again same answer. You were wearing 2 gloves, so you take off the outer gloves, and then you sanitize, then you take off the face cover, then you sanitize, then you take off the gown or the apron, again you sanitize, and last is you take off the mask, and then last you take out the inner gloves also. So inner gloves have to be taken off in the last, and after that you do hand washing and hand sanitization. So that is what is the doffing procedures. So with that, I think we have completed the whole lecture outline. We have talked about the investigations of epidemic, the infection control, PPE, donning and doffing procedures. And with that, I'd like to thank you so much for watching this whole module, this whole chapter on infectious disease epidemiology. I would like to remind you once again that the chapter on infectious disease epidemiology, it's a very crucial and important chapter. It has roughly 2-3 MCQs in almost every nursing exam that you give, because of the importance of this concepts of infectious disease epidemiology. All the very best. Keep on revising. Take care and bye-bye.